the assessment of bone quality of apical periodontitis treated with MTA plug and regenerative endodontic techniques. It's a retrospective study published in 2022 by Banue et al., Australian Endodontic Journal. Endodontic treatment of necrotic immature teeth is clinically challenging, and there are several studies have confirmed the success of treatment with MTA and revascularization using different methods through clinical and radiographic examination. In histological studies, it has been shown that the healing of periradicular tissue after endodontic procedure include the health of bone, periodontal ligament, and cementum. But it's not sufficient to evaluate the outcome according to the size of the lesion only with subjective radiographic methods. Therefore, to obtain more quantitative and objective results, it's recommended to analyze the generation of the new bone from the spongy structure of the periradicular tissue by fractal analysis, which is a quantitative, objective, and non-invasive method that facilitate the characterization of the tissue architecture and the detection of the potential abnormalities. There are various types of fractal analysis, including box counting, which is a method of gathering data for analyzing complex pattern by breaking a dataset or image into smaller and smaller pieces, typically box-shaped, and analyzing the pieces at each smaller scale. The aim of this study was to compare the periapical healing by evaluating the architecture of the newly generated trabecular bone with the fractal analysis after MTA plug and regenerative endodontic therapy. In the material methods, patients who received the MTA plug and RET were evaluated according to radiological examination taken from radiology department between 2017 and 2020. Individual aged between 15 and 14 years without any systemic disease with immature and necrotic permanent teeth with periapical radiolucent lesion less or equal to 5 mm with a wide apical foramen more than 1 mm of and single-rooted and single canal requiring apexification treatment were registered for this study. According to the eligibility criteria, a total of 40 teeth treated with the MTA plug, 25 and RET 15 were obtained, and the distribution of the teeth in the MTA plug group was 12 maxillary central incisors, 1 maxillary lateral, and 2 mandibular premolars, and in the RET group was 9 maxillary central incisors, 4 maxillary lateral, and 2 mandibular premolars. The periapical radiograph before the treatment and 1 year follow-up were obtained. The image were examined by experienced oral and maxillofacial radiologist. Regarding the fractal analysis, it was conducted with the software using the box counting methods by standardizing the dimension and localization of the region of interest area was selected at distance of 1 mm from the root apex and periapical lesion site by parallel line, which made a right angle to the apical and the long axis of the tooth. In the follow-up radiograph, the region of interest was repositioned from the same location according to this distance for each tooth. Each selected region of interest were cropped and duplicated. Then it was filtered to eliminate the brightness in the image due to the superficial soft tissue covering the bone and the varying bone thickness. For each pixel, 128 shades of gray were added, and the bone marrow space and trabecular structure were separated from each other. The fractal analysis then was computed after performing binary etching, expansion, inversion, and skeletonization operation. And the fractal size value was obtained by dividing the image pixel frame into the frame containing trabecula and calculating the total number of frames for each pixel of different sizes. Huang et al. Reported that the fractal analysis can be a useful marker for detecting early changes in the periapical bone after root canal treatment. And according to this, low fractal value indicates a more porous bone with higher spaces, while high fractal value indicates a more complex and denser bone architecture showing the initial healing. The results showed that in both groups, a significant decrease was observed in the periapical lesion size at 1 year follow-up. However, there was no significant difference between the MTA plug and the RET. Secondly, there was a significant higher fractal dimension value were detected at 1 year follow-up in both MTA plug and the RET cases. However, the difference was not significant between the groups. and both procedures seem to improve the periapical healing with a new resistant bone of similar density and complexity. In conclusion, there is still a need of long-term and well-conducted randomized clinical trials with a larger sample size and following standardized criteria for outcome evaluation, and this would allow better comparison among the study's results.